out of ICU beds. And interestingly, Amazonas actually improving situation with ICU beds as the wave passes through and the health system recovers. Other parts of the system and other parts of the country are coming under extreme threat. The Midwest and South regions have bed occupancy, ICU bed occupancy, more than 96%. So 96 out of 100 ICU beds are occupied. There's very little resilience and capacity left in the system. There's also worryingly an increase in positivity of cases, especially people with severe acute respiratory illness. The proportion of them testing positive for COVID-19 is going up, and a significant increase in the case fatality rate, the number of people dying who present with illness, which will reflect the pressure on the system and the lack of time that healthcare professionals have. But we also, in the back of our minds, also have the constant concern regarding transmissibility and the inherent virulence or lethality of the virus itself. Maria may speak to how we're tracking that. Brazil is a great nation and an important anchor in South America, in the Americas, and globally. What happens in Brazil matters, and it matters globally. And Brazil has always been a very positive example of strong public health action. One of the first countries in the world to eliminate measles as a public health problem. One of the first countries in the world to eliminate polio. So there's no question. What happens positively in important and prominent nations matters globally, and what happens negatively in such nations also matters. We certainly would like to see Brazil going in a different direction, but it's going to take a huge effort for that to happen. The system is considerably pressurized right now, and while many countries in Central and South America are moving in a good direction, Brazil is not. I think the DG said it, that this needs to be taken very seriously in Brazil. I have no doubt that Brazilian health and Brazilian science and the Brazilian people can turn this around. The issue is, can they get the support that they need to be able to do that? Maria can speak to what we know, or increasingly know, about particularly the P1 variant in Brazil. With that in mind, all variants of concern are important nationally, and all variants of concern are relevant globally, because we don't call them variants of concern because of their national impact. We call them variants of concern because they have potential implications beyond national borders. Maria?
Thanks, Mike. Yes, that's right. So the P1 variant, the variant that is circulating in Brazil, is of concern because it has a number of mutations that confer increased transmissibility, and there are some studies that suggest that there is increased transmissibility associated with this P1 variant. And that is important because the more cases that you will have, the more cases that will require care and need hospitalization. And in a situation in many states that are already overwhelmed and overburdened, that will put more pressure on the system, and there could potentially be more deaths associated with that. There are several studies underway of this P1 variant, this virus that has these different mutations, looking to quantify transmissibility and looking to quantify severity. There are some suggestions of increased severity as well. But again, that complicates a system and states that are already overwhelmed from a lot of transmission to begin with. I should say what we do know about the P1 variant, as well as what we know about the B.1.1.7, the variant that was first identified in the United Kingdom, and the B.1.351, the variant that was first identified in South Africa. The public health and social